Patients and families are Stoughton Hospital's #1 priority. To provide trusted health information to our patients and community, we present Stoughton Hospital Health Talk with Melanie Cole.
Progressive neurological diseases such as Parkinson's can impair speech and other functions. However, there's proving to be a treatment that can help a patient regain their loudness and ability to feel part of that conversation. My guest is LeaAnn Worachek. She's a speech and language pathologist at Stoughton Hospital. LeaAnn, we're about to talk about a fascinating topic. So start with what happens to people with neurological conditions such as Parkinson's in regards to their speech.
Sure. Thank you for having me. People with Parkinson's and other neurological conditions tend to have reduced loudness with their speech. Their voice is also has a hoarseness to it. They speak in a very monotone way. Sometimes their articulation is imprecise, making it very difficult to understand what they're saying. And also sometimes people with Parkinson's have a vocal tremor.
So tell us about LSVT-Loud, or the Lee Silverman voice treatment. What is this, and how can it help people that have some of these neurological conditions and then as a result have impaired speech?
Yeah, sure. LSVT-Loud, as you said, stands for the Lee Silverman voice treatment. It was developed in 1987 to improve voice and speech in individuals with Parkinson's disease. It is a very effective treatment that has been scientifically studied for over 20 years, and the research that has shown that it improves the vocal loudness, a patient's intonation, and voice quality, and then this improvement is also maintained for up to 2 years.
So how does it work? What does it even really do? Tell us how you work with someone.
Sure. So it's a treatment that is over 16 sessions in a single month. So it is pretty intense. You meet 4 times a week for an hour each time. And it trains the patient to improve their vocal loudness by stimulating the muscles of the voice box and speech mechanism through a systematic hierarchy of exercises that basically is focused on a single goal of you speak loud.
Wow. So, I mean, as I told you off the air, I watched a video of somebody and the transformation that takes place. How does it work? And what kind of results have you been seeing?
The results are amazing, and the people that go through the program say that it changes their quality of life. The program targets the vocal loudness, thinking loud, speaking loud. It's a high-intensive, high-effort program, and then it also works on generalizing what's learned in therapy to a patient's everyday life. So it is very functional. The treatment involves daily exercises that are taught by a speech therapist, and then eventually encouraging the patient to do them independently. So the daily exercises work on increasing their loudness. They work on increasing the pitch of the patient's voice so they're not so monotone. And then they work on functional tasks specific for each patient, such as oral reading and speaking activities that then increase in complexity over the 4-week period.
LeaAnn, you mentioned that this is basically a high-effort therapy. And what does that even mean? You expect the patients to work really hard. Is there a problem with adherence in what they have to do at home, in how hard they're willing to work for this, or are they pretty motivated?
Patients are very motivated once they start seeing the improvements. So there are daily homework tasks that they are required to do at home. And initially they might be a little resistant to it. But then as their caregivers and friends and family members start commenting on how much better they sound, how much easier they are to understand, they are motivated then to complete these daily tasks at home on their own.
Wow. So now what is the training like for someone like you? Is this a separate source of training? How do you get trained to do this LSVT Loud?
Sure, it is a separate certification. So I have gone to school to be a speech language pathologist, and then this is a separate certification that I have taken through coursework. It was a 2-day, very intensive training.
Wow. So just give us a little lesson, a little bit of an idea of what a treatment looks like.
Sure. Great question. So we will always start with our daily tasks. And the first exercise is a sustained ah, and we work on sustaining that ah to seeing how long a patient can sustain it and how loud they can sustain it. And we're not working on yelling or shouting. We want a good quality voice. And then we work on the second task is that we do daily is working on your pitch, how high you can take your voice and how low you can take your voice. So to that addresses how people with Parkinson's have a monotone vocal quality. The third daily exercise that we do are functional phrases, and these are phrases that are specific to each patient. They come up with 10 phrases that they say daily, multiple times a day, and we work on them using their loud voice to say those phrases. So then when they're at home, they are able to generalize and use those phrases using their loud voice. Then the treatment moves into functional activities such as reading short phrases, into reading longer sentences, into conversing using their loud voice that they have been trained to use.
How long does something like this last? So if they get better, and as we've seen and, talked about some of those transformations, is this something that now they sort of have to really keep up? It's like a medication. They just have to keep up with this because some of these neurological conditions are progressive. So what do you
Correct.
tell people and their families about this particular type of treatment and the need to keep going?
That's a great question. So once they finish their 4-week intense treatment with me, then I highly encourage them to continue with their daily exercises that they've been taught through the program, to continue those daily to maintain their vocal loudness. And studies have shown that people are able to maintain the results for up to 2 years. Now they may need to come in, a couple years after going through this voice treatment, just to kind of regeneralize themselves, to have like a maintenance visit or two, and then to help maintain their vocal loudness.
Wrap it up for us, LeaAnn, with your best information about this treatment that people have really never heard of before, the Lee Silverman Voice Treatment, or LSVT-Loud, for neurological diseases, and what you want them to know about coming to see you at Stoughton to learn about this treatment.
Sure. This is a very effective treatment that has been scientifically studied for over 20 years and has shown marked improvement with patients' voice and speech in Parkinson's and other neurological conditions. Patients, they've gone through the Lee Silverman voice treatment, have reported significant improvements in their quality of life. They report improvements in their speech volume, their quality of their voice. They have increased articulation. They have facial expression and just overall speech intelligibility, or how well others understand them.
Wow, it must really be life-changing for some of these people that feel that they're not part of the conversation, or that they're not really involved in a group because they can't be heard, or understood. So that's just amazing. What an interesting topic. Thank you so much, LeaAnn, for being with us today. You're listening to Stoughton Hospital Health Talk. And for more information, please visit stoughtonhospital.com. That's stoughtonhospital.com. This is Melanie Cole. Thanks so much for listening.